All right. I'm inspecting the abdomen, checking to see if there's any edema, lesions, bumps, bruises, or any obvious peristalsis movement. Okay, and I don't see any edema or bumps or bruises at all. So now I'm going to listen in the 4 quadrants, starting in the right lower quadrant. Okay, I heard 3 to 5 gurgles in each quadrant. Now I'm going to listen to your arteries in your stomach for any bruits. So we'll start with the abdominal aorta. No bruit. Your renal aorta, or your renal artery. Then your iliac, and your other iliac. And no bruits were noted there. Do you have any pain or tenderness at all in your belly?
No.
No? Okay. So I'm just going to percuss in each of the quadrants. Okay, so I heard timpani in all of the quadrants. Now I'm going to percuss for the liver border. And it's right here. All right, now I'm going to do light palpation. If you feel any pain or tenderness at all, just let me know. Any kind of pain there?
Oh.
I'm gonna do deep palpation. And any pain or tenderness there?
No.
No? Okay, so now next I'm gonna feel your femoral artery. So I'm gonna pull your gown down. I'm gonna pull the blanket down, keep you in privacy. Okay, I'll feel for the femoral artery. I found it right there. I'm gonna check over here. And those are symmetrical. Now I'm going to listen for any bruits. No bruits noted. And no bruits noted there. Do you mind lifting your gown up so I can inspect your abdomen? I'm inspecting the abdomen. I don't see any edema, lumps, or bumps anywhere? See a couple bruises.
Yeah.
Okay. Some scars from your previous surgery. Okay. All right. Now I'm going to listen to your bowels. I'm going to start in the right lower quadrant. Okay. Right upper quadrant. Left upper quadrant. Okay, and then left lower quadrant. Okay, now I'm going to listen to your abdominal aorta. No bruits. Your renal artery. No bruits there. Renal artery over here. Then your iliac artery. And your iliac artery over here. Okay, no bruits are present. Did you have any pain or tenderness at all?
No.
No, okay. Now I'm just gonna percuss around, and if you have any pain, just let me know. Okay, so I heard tympany. Now I'm going to percuss for your liver border. And it's dull right here. So that's where your liver border is. Now, did you have any pain or tenderness with that?
No.
Okay. I'm gonna do light palpation in all of your quadrants, starting in the right lower quadrant again. And then I'm gonna do deep palpation. Any pain or tenderness?
Nope.
No? Okay. Now I'm going to feel for your femoral artery. So I'm just gonna go down your shorts. It's probably gonna be a little awkward.
Okay.
My hand is right here. Then I'm gonna do the other side. My hand's right here. I'm gonna feel for symmetry. Okay, your femoral arteries are symmetrical. Now I'm going to listen for any bruits. We'll start with your left one. Okay, no bruits present, and your right. Okay, no bruits present there.